would like to talk about core stabilization exercises. In general, we could say Pilates exercises are more for stabilization, and where yoga exercises are for flexibility. However, there is another division of yoga that does train your core as well. First of all, I would like to talk about deep core stabilizers. In anatomy, this is our pelvis. We have these pelvic floor muscles that run at the bottom, which you could imagine like a hammock, okay? And in the front here, between, we call the ilium, it goes across like this. We call that transverse abdominis, so kind of going across my body, but in a very lower part of your abdomen. Our six packs is usually on top here. So we'll call that TA for short, for transverse abdominis. And then we have our diaphragm on top, where our rib cage is, okay? And at the back, we have the lumbar spine or the lower back. There are tiny little muscles that crosses. I'm gonna come a bit closer so you can see. So you go from, in general, just from the spine to the other segments. They are called MULTIFIDUS, or in plural called multifidi. So these four things actually creates a stabilization force. So imagine if this is like a cylinder, we got muscle at the bottom, muscle at the front, muscle at the back, and then diaphragm on top, then that will help us to stabilize us. We call these the deep stabilizers because we really should be tightening up our core before we do other exercises, such as our arms and legs. So here we will talk about these exercises individually. So first of all, we'll talk about the pelvic floor, which runs from our pubes to our tailbone, okay? So we talk about like a hammock. So most commonly, people know these as Kegel exercise, K-E-G-E-L, Kegel exercises. In a basic sense, for ladies, you'll feel like if you need to hold your urine in, that you don't want to go pee, that's the sensation we feel. For guys, it's almost like lifting up your boys, okay? So you kind of just want to lift it up. Now, these muscles are actually very small, so you don't want to do a very forceful contraction. So if you imagine this hammock down here, you're lifting up towards you, okay? And there are some people feel like you want to draw the sits bone in together. So you're going to draw the two sits bone together and also front and back. It's a very small contraction. So what you do is that you could activate these muscles gently. If you could try to hold them for 5-second hold, repeat for 10 repetitions without fatigue, that will be very good. It is actually very hard to do because most people will slowly fatigue as you were holding them, okay? So that's the endurance and repetition of Kegel exercises. However, you could also work on intensity. So you could, they call it the elevator analogy. So if ground floor is no contraction of the pelvic floor, and the 10th floor is like the hardest contraction, you could take it up to maybe like a 5th floor, hold it there, and go to maybe 6, go to 7, and then so you could drop it down to like 4th floor, and 3, and to 0. So you have ability to change the intensity of your contraction. You could mix this with the endurance exercises that we talk about to train your pelvic floor. We talked about the transverse abdominis, which is the TA muscles that we talk about, which runs across from your hip bone in the front to the other side. If you feel for that bone and move in just a little bit, you're gonna feel the muscle there, okay? So on this model, I wanna show you. So if you just put your hand there, I want you to try to do your Kegel exercises while you feel for these muscles. When you do your Kegel exercises, you really shouldn't feel the muscle here tenses up. So when the TA muscle contracts, it almost will push your finger away. So you want to feel that you're able to do your Kegel exercises without this muscle pushing your finger away. Because in our brain, we should be able to activate the pelvic floor muscle and the TA muscle separately. So I talk about you put your finger there to feel for this muscle. If you contract a little bit, you'll feel like if I use I guess use this part of my hand. So when I'm relaxed, if I push it, it's very soft. If I tense it a little bit, it fights me. But you don't want to be working so hard to actually push my finger away. So when you activate your TA, you shouldn't feel like your hand is being pushed away. because likely that means you're actually using other muscle we call the obliques, which is on the side of our body. Now, the trick is we are supposed to do the sequencing of doing your pelvic floor, Kegel first, then do your TA. Okay, now once you activate it, I want you to practice letting go of the TA without letting go of the pelvic floor completely. So you're gonna go pelvic floor, which Kegel in, then TA in, then let go of the TA, then let go of the Kegel. Initially, this will probably be very difficult because our body has forgotten how to use these muscles properly. And particularly if you have back pain, this will be very dysfunctional. So work on that. Don't get frustrated because initially it will be very hard. But as you do them, you should be able to teach your body, teach your brain to activate these two muscles separately. So now we will talk about the multifidus. So in anatomy, it goes from the level above and it runs to kind of tail down to the level below. So it look like accurate signs going up the spine. And the main function, if you think about these two muscle pull, then they could stabilize the vertebrae. So between each vertebrae, they are really tiny muscles that help you to stabilize them. These are small muscles, but together they work very well. So to feel these, it's actually very, very difficult because it's buried very deep in many layers of muscle. So most likely you're not gonna be able to feel that. If we use a mental picture, you should think about if you do the sequencing of the Kegel and the TA, now when you activate the multifidi, if you think about your spine is like a tent post or tent pole, like in a circus, you got the canopy that go around, okay? And then you have the guide wire that pulls down to the ground. Imagine your spine is the pole, okay? And you got the canopy around, which is probably like your trunk. So I want you to activate your Kegel, then activate your TA. Then I just think about your body is getting pulled down to the ground in a very gentle way. And when you do that, your spine remains straight. You don't want your spine to bend, okay? So if you combine those three things together, that will probably get the best mental picture of how to activate the multifidi. There are people who talk about if you put your hand in the back, you could feel them. But really, honestly, the multifidus are very small. They're very deep. You cannot feel them very well. So in summary, I want you to work on your Kegel, practice it for a while. Okay, so then some people I will ask you to start with the Kegel, forget the TA, forget the multifidi, just work on the Kegel for a couple days till you are able to engage it properly, okay? And then you're gonna add in the TA. Again, you could do Kegel and TA for a number of days to make sure you could do them independently and also together. And then you add in the multifidus. The trick is that you have to be able to do these muscles slowly and accurately, or basically means quality is more important than quantity. Because if you work the muscles the wrong way, you're actually teaching your brain to do the wrong pattern over again, which is very difficult to do. So if you're able to stabilize your core muscles, these deep stabilizers we talk about, then we could progress to the future steps where we add in the extremities or our arms and legs.